Hi everyone, just doing some frequently asked questions about Invisalign just now. So the first question is, how do the aligners actually straighten my teeth? So they work basically by putting gentle and continuous pressure on the teeth over the course of time of your treatment. So each aligner is designed to just move the teeth incrementally and shift them very slightly each week. And over the course of your treatment, you'll then go from whatever your starting point is to finishing with a nice, lovely straight smile. So gentle and continuous forces is really the answer, and just moving things nicely towards that end result. So the next question is, how long will I need to wear my aligners before seeing results? Generally, I'll tell patients you'll start to see the teeth moving within the first couple of months really, so 6 to 8 weeks or so. You're going to see some minor movements. More significant movements maybe going to take sort of 8 to 12 weeks before you're seeing them starting. In terms of finished results, it is case dependent, but we'll always advise on a rough timeline. Could be 3 to 6 months for more simple cases, and 6 months plus for the more moderate cases, possibly even a year onwards for more severe cases. The next question is, how long will I need to wear my aligners each day for them to be effective? So for this, I advise my patients that it needs to be at least 22 hours a day. I normally tell them to think of a kind of 90-minute window split up throughout the day where you can have your aligners out for eating, drinking, cleaning your teeth and cleaning the aligners and things like that. But ideally, as close to 24 hours as possible is the best you can do within reason, as well as using things like chewies as much as possible. That really makes a difference to how efficient and effective the Invisalign or clear aligners can be. So hours of wear, really important, as close to 24 hours as you can, and using your chewies or elastics if you've been advised. So the next question is, can I eat and drink normally during Invisalign treatment, and what about brushing and flossing? Generally, I advise patients that you're not very restricted with Invisalign in terms of diet. You can take the aligners out to eat your meals and just watching with certain foods like crusty bread, pizza crust, things like that, just be a little bit cautious. You can't eat with them in because the plastic will distort or possibly warp or break. And in terms of brushing and flossing, twice a day as standard is ideal. And then after meals, either rinsing your mouth before you put them back in, or brushing and flossing again if you feel it's needed, and you can reinsert your aligners at that point. Drinking with the aligner in, really water's the safest thing, but if you've got them out, you can kind of have what you like really. Just ideally low sugar, low acid content is perfect. So the next question is about what types of bite or alignment issues can clear aligners fix and what can't they? In general, I would say that clear aligners can fix a wide range of cases from mild up to severe, depending on those cases. The limitations come in maybe at the more extreme end of the severe cases where potentially more traditional braces are required, depending on the mechanics, and possibly in cases where some surgery is required for jaw position and things like that. But otherwise, Invisalign clear aligners will cover most bases. So the next question is, how often do I need to change my aligners, and how many appointments are there in the treatment? Generally, you'll be changing your aligners every 7 days, unless told otherwise. Sometimes a little bit less, sometimes a wee bit more, up to about 2 weeks, but pretty much most cases are 7-day changes. In terms of the amount of appointments, there's always one to start, so to fit the aligners, there's always one to take them off at the end. In between, thanks to our kind of digital monitoring apps that we use, we'll really only see you when we need to physically do something to the teeth, and that tends to be things like adding another attachment or polishing in between the teeth to give us a wee bit of space. And generally I'll try and do that, I'll space it out 10 weekly. So depending on the length of your appointment, you'll be in for a few appointments in between the start and finish, but you're not going to have to visit us too often, which is nice thanks to our monitoring that we use. So the next question is, will my treatment be uncomfortable? In general with aligners, there is some mild temporary discomfort at the start, especially that first aligner, maybe first 2 aligners, just whilst the teeth are getting used to that pressure on them. When you're changing aligners each week, often there's no real discomfort, but you might just feel that slight tightness with the new aligner each week for a day or so. And generally, some painkillers at the start of the treatment for those first week or so, if needed, is enough to keep things comfortable. When you're feeling that sort of tight sensation on the teeth there, all it means is that they're moving and that they're working towards that nice straight smile at the end. So the next question is, what happens after the aligner stage, and how long will I need to wear retainers for? The most important stage really is the retainers and the retention. You've spent the time and effort getting to the point where you've got a nice straight smile, so we want to keep it that way. So generally I'll tell patients you need to wear the retainers for as long as you want to have straight teeth. So whether we've used a fixed, a sort of subtle fixed wire on the back of the front teeth, or a plastic removable retainer, or more often than not, a combination of the two. You'll be wearing them essentially lifelong, really. The plastic aligner or retainer is nighttime only for most patients, and the fixed wire, if we've used one, is there permanently, but it's very discreet and becomes just part of your mouth very quickly. Next question is, how do I clean and care for my aligners to keep them hygienic and safe? Cleaning them once a day with a retainer or aligner cleaner, so a tablet, there's quite a few in the market, Retainer Bright, Sterident, something like that. I personally use a dental pod, which is like a wee ultrasonic bath. You put your appliance in the pod and with a wee tablet, and that'll fizz away for sort of 15 minutes, and that'll be nice and clean afterwards. Give them a really good rinse with cold water before you pop them back in. You can brush them with a soft toothbrush, just be pretty gentle with them. So maybe after meals, you don't need to do a full clean with a tablet, but just a wee clean is no bad thing with a toothbrush. And in terms of keeping them sort of safe and well cared for, just always use your aligner box, which we'll give you. Don't be tempted to have them wrapped up in a tissue or loose in a pocket or in a bag or anything. It's just a recipe for disaster. So keep them either in your mouth or in your aligner box, which you will ideally have on you at all times.